guess I'd just keep it simple. Wouldn't it be great if our community division helped our community?
Decrease readmission rates and to decrease length of stay.
I think as much as we do have great communication, I think it would be great if we could just continue down that path.
If other parts of the community could see people how we see them.
Could provide continuity of care from home to hospital to primary care to community settings.
Had no boundaries. Just all inclusive.
Could be the standard by which all people with severe mental illness are treated in other communities.
Can somehow put themselves in the shoes of the persons we serve.
Could empower our care managers to have more time to spend with their clients and less time spent on documentation and paperwork.
Set a precedence for mental health care treatment, not only in Rochester, but nationwide, really.
Involve medical and mental health institutions to give our people total accessibility, to give our people equal attentive treatment, and to place our people in the same medical environment that a white person would have for the same disease.
Brought the best of what we have to offer and the best of what our community has to offer together to really support patients, families, and community members to achieve full health, which includes, of course, mental health. And for those people who are struggling with mental health, if the best of us, the best of the community come together, we can really support them better on their road to recovery and then sustain that recovery within the community so they no longer need the services that we provide here.
I personally would love to see that we have some of the lab services available on site, because what we're doing now is we have to refer people to get some of their lab work done to another place.
Developed a robust staff wellness program.
If the community division could evolve to the point where patients would come in for treatment and all of their care would appear seamless across all of the different service providers that they encounter, and for the staff to really feel a part of this bigger team as part of this community, providing care seamlessly to patients without feeling kind of the walls that separate us as individual clinics.
Wouldn't it be great if our community division continued to grow and engage the community and even be able to recruit from our community to better serve themselves?
Could continue to affect change in how our processes of engagement with clients are facilitated, as well as collaborate in a way to help meet client needs swiftly and in a way that makes sense to everybody.
Became the center of a community instead of a community center. I would love to see that. That's my dream, and I think that that's absolutely the direction we're working towards.
Became the model of treatment, the gold standard for treatment across the United States.
Had a definition of community that located themselves in it.
Made it easier for our patients to get all the care that they needed.
Made community partnerships its sole purpose. Because it is with these partnerships that everybody has the opportunity to take their game to the next level.
You know, whenever you try to do something new, it's not without risk. You know, all treatments have side effects. And it's possible that in bringing these programs together, that we would inadvertently restrain their creativity in some way, detract from the sense of identity and spirit that each program has, or build a self-sustaining bureaucracy.
Each of these entities have their own identity and their own culture, and I wouldn't want to see anyone lose that. You know, I think what we do with this community division should be, you know, additive, not, you know, it shouldn't subtract anything.
It really is challenging when our clients receive care outside of Strong. And this is just the truth. I have one guy who's at AOT, and most times I don't know when his next therapy appointment is. It's very challenging to communicate with his providers in a different system. So ultimately, we would love it if most of our clients had their care here, so we could keep track of it and pull things together when needed.
Every time you think you're getting to integration, someone else has a different definition of what integration means. It usually is beneficial to the provider and not to the patient.
Most of the world's healthcare system has a lot of fragmentation between medical, biomedical, psychiatric, psychological, behavioral, and social needs. And I think that this community division seems to tap into all three of those. And so there would be opportunities for us to think about simple things like maybe we could bring some basic medical knowledge to those who are going out and doing outreach into the community to talk about hypertension and diabetes in the context of living with schizophrenia or bipolar disorder.
The poor community has a memory, and that memory goes back to the years of exploitation and other unsound practices, but we can dispel those, and once that is effectively broached, I think we can see services to the poor being vastly improved, insurances for the poor made much more applicable, and certainly we can anticipate partnerships with respect to the community and to the medical institution. Not paternalism, but partnerships.
I think that, you know, we all have a common goal, and I'm glad that, you know, I think we're all, you know, kind of have our own things in place that we're trying to contribute to the overarching goal, and I hope that we're all successful, and I hope, you know, we can all continue to come together. I think it's only going to benefit you know, our community and again, us as professionals.
Everyone that I've encountered that works at Strong Ties has this unexplainable yet just profound compassion for this patient population despite all of the challenges. And I think that's something that is unique.
Our staff here, I must say, we are trained extensively in what we do. And when you come here, when you choose us as a pharmacy, you will know for sure that you are well taken care of.
I see people who work very hard and sometimes for lower wages than other jobs they could get down the street. But I know they're interested in ongoing learning, they're interested in the best care possible, they have inquisitive minds, yet they're very sensitive to those who are not as fortunate as us.
Language is the framework for behavior. A community division that speaks to what we do, that's a framework for behavior.
When we talk about community, we're fundamentally talking about what's being passed on and what we're doing to pass on new traditions, old traditions, habits, practices. We have a role to play as a member of the community in strengthening that as a resource.
We really do care about these patients, and we're constantly looking out for their safety, and we want people to know that we are here if there is somebody that needs the services.